Hi guys, this is Dr. Bhupesh from Dr. BKMOET Institute. So first of all, we are starting up with the writing session today. And again, you can subscribe this channel for the best OET coaching, and our contact number is 76967342256. Today, I'm just going to cover first of all little bit of grammar and the basics of OET writing so that you do not find any problem whatsoever in terms of OET writing. So see, first of all, let's discuss the most simple letter, that is the discharge letter. Otherwise, I normally say do not try to, kind of divide your letters or categorize your letter into discharge letter, this letter, that letter. Again, OET is very simple. Discharge letter obviously means that somebody is hospitalized. If somebody is hospitalized, when he gets the discharge, then that letter is known as discharge letter. That means there would be a discharge plan. So what is the main purpose of these kind of letters? These kinds of letters are majorly written. They are majorly written to make sure that the person who is being written, suppose if I am writing to a community nurse, she has to follow the discharge plan. If I am writing to a doctor, then doctor has to follow the discharge plan. That means you are basically writing this letter to make the person follow the discharge plan. So that means discharge plan is the real purpose of this letter. In OET, the major marks that you get is of purpose, because purpose is the first paragraph. So all the purpose is dependent upon discharge plan. Suppose I will give you an example. A patient came with MI, myocardial infarction. In the hospital, that means hospitalization. In hospitalization, maybe bypass surgery was done. After bypass surgery, the condition of the patient improved. So now what will happen? If the condition of the patient improves, obviously mean he will get the discharge. But now, when hospital has done its work, hospital has done the bypass surgery, now the patient needs follow-up, follow-up care. So that is basically the discharge plan. So we will write the letter to nurse that please follow this discharge plan to make the patient feel better. These kind of letters are known as discharge letters. So what is the major purpose in these letters? Follow-up care. Maximum times, because if the patient is hospitalized, obviously the condition of the patient will improve. If the condition of the patient will improve, he will require follow-up care. So what would be the purpose? How do you write these kinds of letter? Let me write it down for you. So this would be the first paragraph, and I will try to make as simple as I have spoken. So you will simply say, I'm writing, sorry, yeah. So you will say, I'm writing this letter regarding Mr. X who was admitted. So this is the first place where you can learn grammar. Who was admitted? What does it mean? Was plus third form. That is a passive voice. That means who was admitted by us. This is the first thing you should know in the grammar. I'm writing this letter regarding Mr. X who was admitted to our hospital due to severe chest pain. X-ray was done, sorry, severe chest pain. ECG was done and he was found with MI. Whatever the findings means, if anything like this is given, so you mention all these things that these were the major tests done. So you will say, I'm writing this letter who was admitted to our hospital due to severe chest pain. You can also use a very good word over here, that is here. That means here means in hospital. ECG was done and he was found with MI. Therefore, stent or bypass surgery was done. And now again, a special line. And as a result, this is also a very special word. So today, the thing that I am teaching you now is how to use connectors, how to make a story in the first paragraph. So I'm writing this letter regarding Mr. X, who was admitted to our hospital due to severe chest pain. Here, ECG was done. So you follow the sequence: symptom, investigation, diagnosis, treatment. And as a result, his condition has improved. So that is again the second thing you write. So then you say his condition has improved, connector. So he is being discharged. However, this is the main thing. However, he needs follow-up care and hence is being referred to you. This is the complete first paragraph. So I have just told you how to write the discharge plan in the easiest of the ways. Means if you will write this kind of first paragraph, then examiner will pass you anyhow, because then he will not be reading the next three paragraphs carefully, because now he can understand that your grammar is very good, your connectors are very good. So this makes very easy for the examiner to pass you, because see, in this kind of paragraph you have written everything. You have written that patient was having severe chest pain, the reason of admission, then investigation, then myocardial infarction diagnosis, then surgery was done, condition has improved. So you have shown the variation of grammar as well. From the past, surgery was done, you have reached to condition has improved. So you're basically what you are telling examiner that your grammar is very good. So if in the first paragraph you can tell the examiner that your grammar is good, your connectors are good. See this small connector, this one as a result, and as a result, bypass surgery was done, and as a result, you can also use a better word, consequently. This is a very nice word which you can use rather than as a result. And consequently, his condition has improved. So he is being discharged, another connector. As the condition has improved, so obviously patient will get discharged. Therefore, however, he needs follow-up care, another connector. However, he needs follow-up care and hence he is being referred to you. That is the best way of writing first paragraph. Best way. Best way. Because now examiner knows your connectors are good, your story is good, that you have told everything about the patient. So the next paragraph when you will write, he is a smoker, Mr. X is a smoker. So next paragraph would be social history. Mr. X is a smoker and he drinks as well. So these small things as well. Then you will talk about medical history. His medical history reveals that he is a known case of diabetes. So that is how the second paragraph is framed when you talk about the social history and medical history. So this is social history, whatever you want to write in the present tense, he's a smoker, he drinks, and then you use the line, his medical history reveals that he is a known case of diabetes. So second paragraph is all about social history and medical history. Then the third paragraph. This is the main paragraph where examiner will check your grammar. So, and it is the easiest one. During hospitalization, I will write it for you. During hospitalization, the patient or he, otherwise you keep on using he suffered during hospitalization. He was having severe chest pain. So ECG was done. Now the story will repeat, but don't repeat it too much. So only write few points that ECG was done. Now change the connector. I will tell you a very special connector in which this is a very special connector when you are doing investigation. X-ray was done in which fracture was found. ECG was done in which MI was found. Or you can say patient was found with myocardial infarction. Then again you will say, therefore, now the story obviously will remain the same. Therefore, bypass surgery was done. Then there would be lot of other points which will be given. So you will write all those points that, he was given diabetic diet and all that stuff. So in OET, whatever the data is given, in this paragraph, try to use as many passive voice. Like now you can see passive voice ECG was done. MI myocardial infection was found. These all things are passive was plus third form was done by us. Bypass surgery was done. He was given diabetic. This paragraph will majorly be about was plus third form. But if there is any word like increased or decreased, suppose blood pressure, blood sugar level, it will always be an active voice. How do you write active voice? Like if I say his blood sugar level got increased. This is the way to write increase or decrease. Always use the word got. Never say was increased. Otherwise, it would be a passive voice that blood sugar level was increased by us. Never write was. So this is the special thing you have to take care in the writing, in the grammar. So his blood sugar level got increased, for which insulin was administered. Again, passive voice. That is what they want to know, whether you know the difference between active. So in this sentence, I've used active and passive both. Blood sugar level got increased, for which insulin was administered. So this is what OET wants. Every data would be given to you. You just have to put the right grammatical sentence. That's it. So again, first paragraph about purpose, second paragraph about social history and medical history, third paragraph in the past tense about during hospitalization. Now, how to write the discharge plan? Always start the discharge plan with this line. It would be greatly appreciated, comma, if you could always use this sentence for the discharge plan. Now, whatever is given, so if you could help the patient, or if you could educate the patient about diabetes, or if you could educate the patient about myocardial infarction, about how to recover. So whatever the point is given, so first line should always be, it would be greatly appreciated if you could educate. After any models, can, could, may, might, shall, will, always use the first form. So then the first form will come. It would be greatly appreciated if you could educate the patient regarding whatever the point has been given regarding diabetic diet, regarding regarding his health, whatever the point is given. Regarding means about. So you can do this point. Second line, how to write the second line of the discharge plan. Always use an imperative sentence. Kindly encourage the patient. Whatever is given again, kindly encourage the patient, or you can say kindly educate the patient, or you can say kindly motivate the patient, whatever is given, or kindly assist the patient. Means whatever point is given, always use the first point. So first line, always it would be greatly appreciated. Second line, always kindly encourage the patient. Now tell the examiner that you know how to use the passive voice. So how do you make a passive voice? This is the way. He should be plus third form. If the point is that patient should be encouraged to take diabetic diet, or patient should be encouraged for walking, so you just say he should be encouraged for walking. This is very important to be used. OET is all about telling the examiner that you know the grammar very well. So as you have seen this video, again, it does not take even 10 minutes. It does not, OET writing is so simple, it does not take even 10 minutes. If you know what to do. So I have, in this small video, I have told you what to do. First paragraph purpose, second paragraph social history or medical history. Suppose if you have to say, suppose if patient was a smoker, so he should be encouraged to quit smoking. So this can be the point. To quit smoking, and also to reduce drinking. So that is how you write the OET letters. The most special thing I would like to tell you that in OET letter, especially the discharge letter, this will decide the data selection. Data selection is all dependent upon the discharge plan. Now the question is why? Suppose if I am writing to a nurse for the follow-up care, so if I am saying that patient needs to quit smoking, if I am telling the nurse that you should encourage the patient to quit smoking, I am writing he should be encouraged to quit smoking. So I am writing this letter to the nurse to tell her that you need to encourage the patient to quit smoking. So obviously in social history, I will write he is a smoker. Suppose if I forget this line, patient X drinks. Suppose if I do not mention that he is a smoker and in the last I say he should be encouraged to quit smoking, then it is completely wrong. Because when he does not smoke, then how can you encourage him to quit smoking? The whole data selection is dependent upon this paragraph. That is what I want to say. Whole data selection. I hope everybody has I hope everybody can understand. Suppose even if I talk about during hospitalization, if I talk about this line, he was given diabetic diet. So because in the discharge plan, there was mentioned that nurse has to take care of diabetes. That is why we mentioned that even during hospitalization, we took care of the diabetic diet. And the same thing has to be written in the social history that patient is a known case of diabetes. Means everything is connected with the discharge plan. Every single thing is connected with the discharge plan. So the whole data selection will be dependent upon this paragraph. So whenever you say, sir, I am unable to control my words, I am unable to control my data. So you need to see your discharge plan. All the points which are mentioned in the discharge plan are very, very important. So whole of the letter is dependent upon discharge plan. I was little fast today, maybe just to save time because the discharge plan letters are the easiest letters. But tomorrow we will cover the visit letter pattern. We will not give more than 10-20 minutes to writing because we have to do the reading class as well. So today we have covered the discharge plan letter, including how to write it. Always use the passive voice. Listen to this video 2-3 times to understand how to make your OET letter effective. So it is the connectors that we have used like for which, in which, and as a result, his condition got improved. All these things are very, very, very important. I hope everybody has understood. If you have any question regarding discharge letters, you can ask me, please. I'm just opening it for you. If you have any questions in this to ask, any grammar, any portion that you would like to ask, I'm happy to answer. Anything, please. Anything. I have unmuted you guys if you want to ask anything. Active, passive, whenever there is any word like increased, decreased, improved, like if I have to say his condition improved, so I will say his, I'm just writing this over here, otherwise it should come in this. So if I say and as a result, MRI was, sorry, surgery was done, and as a result, his condition got improved. So today I have told you the main word, and this is the place where you do maximum grammar mistake. Always write got improved, got decreased, got increased. Means if any parameter, blood sugar level, anything is increasing or decreasing, you say got increased or got decreased. Never say blood sugar level was decreased. That means it is a passive voice. Blood sugar level was decreased by us. They will not let us go. That is the main thing. That was the main point of discussion today. To tell you how to write the OET letter and also to tell you the difference between the active voice and the passive voice. Again, please guys, if you have any question, you can ask me. No questions at all. Everybody is satisfied?
Yes, sir.
Yes, sir.
Yes, sir.
Are you
Yes,
sure?
sir.
Yes, sir.
Okay. Then I will take your words. And did you understand the connectors? What are the connectors? Okay, tell me the connectors we have used.
For which?
Therefore, Hence, as a result, or which, in which, however, therefore,
However,
due to which,
Consequently,
consequently,
sorry,
and consequently,
consequently,
consequently, but again, please make sure your spelling should be right because consequently does not give you any extra marks. But if you do spelling mistakes, it will take your marks away. Then we can also see few more things. Suppose if there are multiple symptoms, suppose we are saying, I'm just going to mute you guys just to tell you what are the other bit of connectors that you can use. Just to tell you in this video only. Suppose if we are saying he visited with chief complaint of A, B, and C. A, B, and C means any kind of symptoms. Tiredness, lethargy, fever, nausea, vomiting. Then this is the word you will use along with that. In the past tense, always use the word that. Along with that, he was having D, E, and F. So if there are multiple symptoms, then this is the word you will use along with that. If it is in the present tense, suppose if you are saying today, what is present? Okay, I will copy paste. How to change past into present? Like today visit. So today, now I will copy paste. Today, see how to convert in present. He has visited. So has visited means present perfect. Has plus third form. He has visited with chief complaint of this. That will become this. Along with this, he is having D and F. This is how you change. In the past, it is always along with that. In the present, it is along with this. So always remember all these things. And we have used a very simple connector as so as well. So is always used with comma. Therefore is always used with full stop like this. After therefore there is a comma, but before therefore there is a full stop. So notice these small points. However, always use with full stop. We cannot use full stop, but as per OET, these connectors, small connectors like so or but, should not be used after full stop. They should be used only with the comma. So that is why but should be replaced by however. However means but. What and when however is used means when there is positive thing. Condition has improved, so he is being discharged. Positive thing. However, he still needs follow-up care. That is the negative thing. That means patient still needs help. So whenever there is combination of positive and negative, however is the word used. However is the connector used when there is a positive and negative. I hope everybody is okay. If you want to ask anything, you can ask me, guys. So in this video, means discharge letters are the easiest one. I wanted to cover grammar today by the medium of discharge letter. I wanted to cover first level. First paragraph is about purpose. Second paragraph is about social history, medical history. Third paragraph is about hospitalization. Fourth paragraph is about discharge plan. Important thing I wanted to tell you, discharge plan is the main thing of the letter. That is the purpose. This is the main purpose of the letter. And in the first paragraph, this is the main purpose. By chance, if you do not follow this pattern, then you can also write only this thing. Suppose if I do this, even then you will pass. I am writing this letter, Mr. regarding Mr. X, who needs follow-up care. Hence, he is being referred to you. This is the purpose. This also I wanted to tell you. Means if your letter is very complicated and you are unable to make the story, then first paragraph you should never take the risk. Just write this much. Main purpose that what the patient needs now. Does he need follow-up care? Does he need expert advice? Does he need diagnosis because he is suspected with something? Write the main thing. Do not write anything extra because extra things can harm you if you are not sure. If you are sure, it will give you 400. That's why our students score 390, 400, 410, 450 sometimes. This is the reason that they write very good first paragraph. But if there is any problem with your grammar, you're not sure about the data selection, then this is the best thing. Write only the main thing in the first paragraph. Don't commit any mistake in the first paragraph. Second paragraph, social history and medical history. This is social history. How do you jump to medical history? By using these keywords. His medical history reveals that he is a known case of whatever. Suppose he is having hypertension. Along with this, he is hypertensive. That is why I used that thing. So you can use along with this over here as well. Otherwise, you can simply say better way of writing it, and he is hypertensive as well. This is a very nice way of writing that his medical history reveals that he is known case of diabetes and he is hypertensive as well. You can notice this comma before and because I am using the subject again. Whenever I will use the subject after and, then I will put this comma. If I do not use this subject, suppose if I do not use this subject, then I don't need a comma. Please listen to this video again to understand. Reveals that he is a known case of diabetes and hypertension. Then you will write this way. That is how writing differs. So you need to understand when to put comma before the end. Then during hospitalization, 90% of the times will go in the past. He was having this was done, passive voices. But again, in the quest of passive voices, if there is anything that has improved, decreased, increased, then always use the word goat. Like in this. Okay, blood sugar level got increased. So today again, the main motto was to teach you grammar and to tell you how to write the discharge plan letters and bit of connectors that we have used. I hope you would learn a lot from this video because again, I have been teaching since 11 years, since last 11 years. And considering that fact, sometimes I feel bored in teaching this kind of basic things. But I hope the people who are looking out for the video that where to start OET writing, this would be a perfect video to understand grammar, to understand different paragraphs, 1, 2, 3, 4, what to write. So basics of writing OET letters for all of you. Please go through this video again and again. Connectors and everything is being mentioned and including lot of grammar. So this video would help you to become better. Please try to revise this video. Even if you know how to write OET letter, this video will improve you and will decrease the mistakes in active, passive, and in connectors. Thank you very much. Take care. Bye-bye.